Hello, and thank you for joining me this afternoon for this session. It's just a small number of us live today, but if you do have questions, please don't hold back from asking them. You can type a question in the chat box, which comes up as an option on the more options on the menu bar, and hopefully we can answer, or I can answer any questions you might have. But also do feel free to get in touch after the event. The email address for vet professionals was on the last slide. What I want to do just now is to provide a bit of an update. As was the case last week when I did a presentation, there have been some new little bits of information coming out this week as well. So my task will be to try and include whatever new information there is, as well as how that fits in the context of information that perhaps came out last week. And of course, I hope anyone listening to this, whether live or post-event, I hope that you're okay and all of your loved ones also are doing well in these very, very difficult times. So let's look at firstly the background to this disease, and this slide hasn't changed from last week if you did listen then. So just a reminder that we're talking about a coronavirus called SARS coronavirus 2 as a cause of an illness in people called COVID-19. And whilst it was first reported in China, of course, now it is everywhere, highly infectious, highly unpleasant virus that is resulting in large numbers of people needing hospital care. And very sadly, significant number of people are dying as a result of this disease. Reputable websites at the bottom of this slide that I think you can consult. But let's move straight on to looking at what we know today about COVID and cats. So over the last few weeks, little bits of information have come out. And from a domestic cat, a pet cat perspective, we have a few case reports where cats have been tested. For example, a cat in Belgium, this is, I think, approaching about 2 weeks ago now, that this cat was unwell, had some respiratory and some gastrointestinal clinical signs, and was being looked after by someone suffering from COVID, so was known to be an infected household. The coronavirus was found in this cat. It had a PCR test which was positive. However, we still don't really know the significance of that result for this cat. The cat has got better, and it's really not completely clear whether the coronavirus was responsible for the cat's illness or not. We just unfortunately can't answer that question. In Hong Kong, also there has been a report, this is about a week ago now, of a cat that was owned by a person suffering from COVID, and I'm not quite sure why this cat specifically was tested. The cat's not reported to be ill, but was reported to be positive on PCR testing. So perhaps an indication that the cat may have been also infected, but in likelihood infected from its owner rather than the other way around. 2 dogs also in Hong Kong where the virus has been found. Neither of those dogs were thought to have illness as a result of COVID, although I think one of the dogs has since died. It was not thought to be related to the virus at all. I think it was quite an elderly dog. And I also have read that in Hong Kong, some testing has been done on pets in households with confirmed cases of COVID, so people unwell as a result of this infection. And as you can see here, they found that there were just 2 dogs that tested positive for the virus. So whilst, as I'll talk about next, there is some susceptibility, I think, that cats will have to this infection, it's by no means an assumption that they will automatically be infected by people. Perhaps their vulnerability is much less, well, I think is likely to be much less than ourselves. And then lastly, another cat report here was, you may have heard that a zoo in New York, in the Bronx, has had some unwell big cats, and Nadia, a tiger with some respiratory signs, coughing and wheezing, was sedated to allow testing and was found to be positive for this coronavirus. In fact, other big cats in the same group as Nadia also, I believe, are unwell. They've not been tested because testing requires sedation but the assumption is that it could well be the SARS coronavirus in these big cats as well. And at the moment, I think it's a little bit unclear as to how these cats became infected. So they suspect perhaps a member of staff was responsible for transmitting the infection, but I don't believe that that has been confirmed as yet. Last week, I included some information from this study where an experimental study done in China looked at susceptibility of different species of animals to the SARS coronavirus. As you can see from the test result here, they did find that they could infect cats with the coronavirus, and in fact that infection could be transmitted to other cats. But probably very important to mention that firstly, this is a study that's not been through the peer review process, which is normally required for publications. That means that no one has really had an opportunity to critically appraise the methodology and see if there are any holes, any incorrect issues with the way that the data has been presented. Secondly, it's an experimental study and it involved inoculating these cats with very high doses of virus. What does that mean? Well, it means that it's not a natural situation. They actually probably had the virus in a liquid which was dribbled, I think, down the cat's noses to infect them. So it doesn't reflect the normal real world situation. Quite a small number of cats tested, and the cats were not reported to be unwell, although they did find some abnormalities when they tested those cats' organs after the cats were put to sleep. So an experimental study that indicates cats can be infected with this virus, which, to be honest, I think is not a surprise, because we know with the SARS coronavirus in 2003 that cats also were infected with that. And although they were not thought to be important in the transmission of the virus epidemiologically, so they were not responsible for infecting people, they were a bit vulnerable to being infected themselves. A second study that's come out from China this week is what's called a serological study. So this is looking at serum antibodies in cats, and the researchers looked at serum. This is the clear bit of your blood sample, which contains proteins, including antibodies. And they looked at serum samples from cats from hospitals and I think some cat shelters as well in Wuhan, where the initial outbreak of COVID was reported. 102 samples after the outbreak, 39 prior to the outbreak. And they found about 15% of the samples collected after the outbreak were positive for antibodies, indicating that these cats had been infected with the coronavirus. And an antibody response usually happens a few weeks after infected, maybe 2 to 4 weeks after you're infected. At the time they sampled the cats, they didn't find any that were positive. So look like they were infected based on this data may not have been shedding virus in significant quantities during the period associated with that. So again, this is new data that hasn't been through the peer review process. It does support the fact that, and I think we can certainly believe that cats can be infected with this same virus. And in fact, the highest levels of antibodies were in those cats owned by people suffering from COVID, which makes very good sense. But they didn't, as I say, find that the cats were PCR positive, so they were not a source of infection at the time of testing. Which may, I think, be encouraging in terms of indicating that, as we suspect, cats are probably not at all important in the transmission of this illness to people, so that they may be infected themselves, but they're not going to be a cause of big problems in ourselves. But we do need more data to support that. IDEX, a big vet lab, has done some screening for samples they received to see if they have found any evidence on PCR of the virus, and they have not found any in their data so far. This was not selected samples of pets in households with COVID sufferers. This was more of just a sort of random sample of samples coming in to their lab that they tested, but nonetheless, at this point, this was about a month ago that they did this test, they didn't find any positive samples. So what are the take-home messages from all of these studies so far? Well, I think human to cat transmission of COVID looks to be possible. Based on the serological data from Wuhan, it does look like a proportion of cats, particularly those in households with COVID sufferers, probably were infected, and that accounted for their positive antibody test in that study. But we certainly haven't seen a mass outbreak of illness in cats, so it does look like if domestic cats become unwell at all, that the disease is likely to be very mild. That Belgium case is still, I think, under debate as to whether that was at all related to COVID, or whether perhaps there was contamination of the cat's samples by the owner because the cat was being cared for by someone who had COVID themselves. But of course, until we do widespread testing, we can't fully answer these questions. If a cat is infected, then it potentially could transmit that infection to the environment, and could potentially be a source of infection to other cats, as was shown in that experimental study from China, or potentially to people. However, I think still the feeling at the moment is that firstly, there are no documented cases where transmission to a person has occurred from an animal, and that the risks of that are very, very small based on the fact that the data we have available to us at the moment, and that person-to-person transmission is absolutely the most important route. Hence the importance of the current lockdowns that we're all having to experience. What measures are sensible to consider with respect to cat care and cat ownership? Well, if you or anyone in your household does have COVID, then where possible, it is a good idea to try and isolate your pets with yourselves. So if you have a cat that is happy to be indoor only, whilst you are self-isolating, that 7 to 14 day period that the government recommends, depending on symptoms of COVID within the household, then if you can keep your cat inside with you, then that is probably a good idea. However, we do need to be sensible and also consider the cat's welfare. If keeping the cat indoors is going to be very stressful, then it could be counterproductive from the cat's welfare perspective. And also we need to consider the environment we're in. So if you live in the middle of nowhere in a cottage where it's just perhaps you and some fields, then the chances of your cat being able to transmit any infection to anyone else are obviously going to be very, very small compared to if you're in a very, very highly populated area. And also if you know your cat really loves visiting the neighbours, going into their homes, being fed by them, being cuddled by them, then that's obviously a very different situation. And if that's the case and you can't keep your cat indoors, then talking to your neighbours by phone or email to explain to them, please don't let our cat in at the moment because we either know or suspect we have COVID, and we want to obviously minimise the risk of transmission to you. And if you are out and about at the moment and you meet a friendly cat on your walk, perhaps just be a little bit more cautious about petting that cat, because although the risks, I believe, are very, 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 very tiny, we can avoid those. So I would say probably don't handle animals that are not yours outside your home, because you don't know the background that they're coming from, and don't let other cats into your house at the moment if at all possible. If also you have a COVID situation in your household and you know you need to see your vet, so you have an emergency situation, then make sure that your vet practice knows that you are in that self-isolating because of either known or suspected illness yourself, so they can take the appropriate precautions and get someone healthy to collect your cat from your doorstep and take it to the vet clinic for you. And of course, remember all the hand washing and hygiene that has been very much emphasised over the last few weeks. The British Veterinary Association website, I gather yesterday, crashed as a result of some of the press releases about cats potentially transmitting coronavirus. And just to highlight the information that they have on their website at the moment, which I would totally agree with, as it says here, we're not advising that all cats are kept indoors, only cats from infected households or where their owners are self-isolating, and only if the cat is happy to be kept indoors, because some cats cannot tolerate being kept indoors if they're used to going outside. As I say, that can be very, very stressful. There is no evidence that pets can pass COVID to their owners. So where cats are infected, it is 99.9, if not 100% likely that that infection has come from a person. Please don't look at your cat as a risky animal to handle. I'm giving you all the information, but I hope it is reassuring rather than concerning. And if you would like a copy of the slides that I'm using, please just email us at info@vetprofessionals.com and we can do that for you. Vet clinics, meanwhile, of course, are working hard to support their clients and are also, like ourselves, finding it a very stressful situation. They may appear to be closed, but they still very much are open for supporting you and of course any emergency treatment that's needed, but also repeat prescriptions in the same way that your doctors also are still continuing to work in a routine sense. The advice at the moment is that vet practices should minimize contact with people because of COVID. So we want to keep vet clinic staff safe and also, of course, cat owners coming into the clinic safe as well. So for that reason, any elective procedures should be delayed. So this might be a neutering operation that has been planned for this month, for example. And if that is the case in a cat, then again, if you're keeping the cat inside, hoping to let it become an indoor-outdoor cat once it's been neutered, it may need to be an indoor-only cat for a bit longer until neutering is possible. Cats can get pregnant very easily, so just be aware of that possibility. And of course, speak to your vets because they are very much open for advice and support. The World Small Animal Veterinary Association had this resource on its website, which gives just some advice on contacting the vet clinic. And I think it all is probably very obvious based on the contact advice for everything else at the moment. So not to go there in person, but to phone or email first. Follow the advice you receive. Vets have been allowed a bit more flexibility with what they can prescribe over the phone or on a video consultation. So we can still, of course, treat your animals to the best of our abilities. But if there is an urgent procedure, an urgent operation, for example, then a vet visit may be required. And if that's the case, it should be a healthy person and just one person taking the cat to the clinic and following the clinic guidelines. So what some clinics are doing are basically almost a car park handover of animals where the cat carrier receives some disinfection from the clinic on the handle to carry the cat into the clinic. The cat is examined and then returned to the owner, and there's a phone discussion with the cat in the consulting room whilst things are going on to explain what is needed. So this is all a bit of new territory for many vet clinics. So do be patient and aware of the stress that they will be feeling as well as yourselves. Everyone is feeling very stressed and anxious at the moment, which is only natural. If you think your pet pet is a genuine emergency and needs to be seen in a hurry by the vet clinic, then don't hesitate to phone them. And some obvious examples listed on this slide, but if you are in any way worried about your cat or other pet, pick up the phone, because they will be answering the phone, they will want to hear from you, and they will be able to advise you on things you can do at home, but also whether or not your pet needs to be seen and how to achieve that. Vaccinations are an example of an area of healthcare which is a little bit difficult at the moment, because vaccinations are typically healthy animals coming into the clinic for preventative treatment, so to keep them protected in their normal environment. And so I would say, from a reassurance perspective, that if your cat has had its primary kitten vaccinations and a booster at 1 year, then a delay of 3-6 months is not likely to affect their immunity in any adverse way. So in other words, don't worry about a delay to their booster vaccination. The only animals that are a little bit more vulnerable are those that have not had those primary vaccinations as a kitten and then the booster at 1 year. These animals may be more vulnerable, and so again, if they're not going outside because they've not completed their primary course, keep them inside throughout the lockdown period, if at all possible. And then you may find you need to restart the vaccination once the vet clinics are able to open properly again. And I suspect that the vaccine manufacturers will help vet clinics to be able to do that without additional fees. I can't guarantee that, but I suspect there will be a lot of hard work to make sure that no one is financially out of pocket by having to do that. So the more challenging cases definitely are the younger cats, the kittens that have not had any or all of their vaccines, and those potentially are at an increased risk. So as I've mentioned, if they're already indoor only, then keeping them indoor only is a sensible thing, and then start their vaccinations once you can. But do speak to your vet clinic as well, and bear in mind that information and advice about the lockdown could change any day now. So we may find there is more flexibility to do vaccinations. If in doubt, speak to your vets. There are lots of websites that have resources for pet owners listed here, and some of these also have great information on coronavirus. Some have great information on other stuff as well. And again, if you want a copy of the slides for reference, then please just let us know. So in summary, postponing elective procedures for the moment is the recommendation. So anything that can be put off, basically do put off. But we do need to bear in mind, and certainly vets are very much bearing in mind, that there are some illnesses which can sort of grumble along, and today might not be an emergency, but if we don't do something for 3, 4, 5 days, maybe it will become an emergency then. And so I think if in any doubt about your cat's appetite or their general well-being or their health, if you have any concerns at all, then definitely do speak to your vet clinic and get their advice and get a plan in place. There are actually a lot of things that you as a carer can do to support your cat at home, and I'm going to start featuring that in future cat cafe sessions. So how you can tempt your cat to eat if its appetite is not very good, what safe things you can try, how to support it if you perhaps aren't as able to get to a vet clinic as would normally be possible. And of course, all from a coronavirus perspective, again, that hygiene reminder, but also just a little reminder here that if you're not already aware that phenolic disinfectants, things like Dettol, things that turn the water cloudy, are toxic to cats. So if that is the only disinfectant you have in your household, then do make sure that you rinse anything that might come into contact with the cat after using Dettol, and don't use Dettol ever directly onto a cat. Also, from a disinfection perspective, don't be tempted to disinfect your cat if it goes outside and you're worried that it may be bringing infection back into the house, because many disinfectants are potentially irritant to cats, and if they groom them off, they may cause mouth ulcers, for example. So I would say, rather than doing that, would be just to make sure you wash your hands thoroughly after handling your pet, and of course, if you are in a COVID positive household, follow the isolation recommendations that I talked about a bit earlier. So I hope that's been helpful. Please don't hesitate to ask some questions either in a moment or via email. And also, if you want other topics to be covered in future sessions, then again, please email through your thoughts on that so that we can put together a program that looks helpful for you. But I shall stop at this point and just be happy to answer any questions if there are any questions, either via the chat box, or if you want to unmute yourself and speak to me directly, then also feel free to do that.